coming up.
We call it the Gillespie Approach, CFT. It's different from CST, which is cranial sacral therapy. And we get a lot of questions about that we can go into later. But I'll just give you a brief explanation as if you don't know anything about CFT. Mm-hmm. So we're combining two different modalities here. The cranial sacral system, which is our brain here, and then our occiput sacrum. It's all the cranial nerves, all the cranial bones, the cerebral spinal fluid. And this system sits inside of the fascial system. So the fascial system is a web, and fascia is all the connective tissue in the body: tendons, ligaments, superficial fascia, deep fascia, a lot of fascia in the brain and spinal cord. So we have 3 layers of fascia around the brain, which is our little sphere here, and around the spinal cord. And this system lies within the fascial web. So when we have tightness in the body via the fascia from tight space in utero for babies, they come out, tethered oral ties, accidents, injuries, surgeries, dental work, that tight fascia pulls on this system, the cranial sacral system. And so that's going to affect nervous system. It's going to affect the cranial nerves and obviously oral function, as the fascia and all of the tissue in the mouth
We know that there's some kind of tightness in this web of fascia within the body that's bearing down and inhibiting the optimal flow of cerebrospinal fluid. So why is that important? Cerebrospinal fluid flows from the brain down the spine out into the fascia. It helps nourish the body. It helps detoxify the body and just puts us in a better healing environment within our bodies. So our goal is always to be improving that cycle, because it tells us that something's happened and that we've opened up the body in a way that will allow for optimal healing or health.
We have a special offer for our Munch Bunch listeners. To book a virtual consult with Megan, she's offering a discount of $25 off. Just email her, Megan, at nwmyofunctionaltherapy.com or through her website, www.orofacial-myology.com. To book a virtual consult with Kimmy for the $25 off, email her mouthmusclememory@outlook.com or through the website, www.mouthmusclememory.com. Now on to the episode.
Hello, and welcome to the Munch Bunch podcast. I am your co-host, Megan Vanoy, with my bestie, Kimmy Nishimoto, and we are so excited to have everybody here today. We have Kimberly Sherlock and Holly Steflik on with us. They are licensed massage therapists and are instructors of the Gillespie Approach. And we're going to let them speak all about what that is and introduce themselves here in just a second. But as you guys know, one of the things that we've started doing at the beginning of our episodes is setting our intention a little bit and pulling our affirmator. So Kimmy, what's the vibe of this episode today?
I gotta get in the zone.
Love
here. Okay. It is limits.
So funny. I pulled that card yesterday.
Are you serious?
Yeah,
that's funny.
We're in sync.
Limits. It's fun to be a yes person, but not when yeses are maybe responsible for my suddenly having no time, patience / clean underwear. So I hereby declare that yes, I am sometimes allowed to say no. I know what I can handle, and nothing is going to fall apart if I nobly admit that I am not able to do another dang thing to my looming pile of now stuff. And yes, I would like a nap. Thank you for asking.
Kind of the perfect time of year for talking about limits and boundaries, and when you have a million holiday things to do and family and yeah, that's a good one. And yes, of course, I have my Christmas sweater. Kimmy, I don't know if you've seen this one yet. It's Jolly. My Jaws Christmas sweater. So you guys can all really enjoy that one. I also bought matching ones. So Izzy Baby has one too.
A Jolly one?
Yeah. Mm-hmm, yeah.
Awesome.
We have Santa Claus kitty ones. And then now we have Jaws shark ones because she loves cats and sharks, randomly enough.
She's brave.
I know she is. So Kim, Holly, introduce yourself, say hi, and talk to us a little bit more about what the Gillespie approach even is. We get conversations all the time around body work, right? Like this umbrella of body work, but so much falls into that. And we know, just like in our space, like all of the acronyms get a little bit confusing. And so tell us more about what cranial sacral fascial therapy is, CFT, and a little bit more about the Gillespie approach.
Okay. Kim, is it okay? You want me to do this?
Take it away.
Okay, great. Well, actually, I just realized that I'm in my office and I have my little props here that I use to explain to students and parents. So let me just grab them 1 second.
We love props. I know some people have had some of the coolest skulls. Like,
here we go.
Yes. I need them all.
this little set of a sacrum and a occiput here, which I'll have to hold up here. This is what we call the cranial sacral system. And so you were asking me earlier, Kimmy, about, the approach and how is it different from other modalities. So I guess I'll just go into a little explanation of CFT, the Gillespie approach. It's named after, obviously, Dr. Barry Gillespie, who founded this modality some 30 years ago as a periodontist. And I'll let Kim talk a little bit about him once we finish this. But anyways, he's a periodontist, and he founded CFT many, many years ago, and it has just evolved over the years. And we call it the Gillespie Approach, CFT. It's different from CST, which is cranial sacral therapy. And we get a lot of questions about that we can go into later, but I'll just give you a brief explanation as if you don't know anything about CFT. So we're combining two different modalities here. The cranial sacral system, which is our brain here, and then our occiput sacrum. It's all the cranial nerves, all the cranial bones, the cerebral spinal fluid. And this system sits inside of the fascial system. So the fascial system is a web, and fascia is all the connective tissue in the body: tendons, ligaments, superficial fascia, deep fascia, a lot of fascia in the brain and spinal cord. So we have 3 layers of fascia around the brain, which is our little sphere here, and around the spinal cord. And this system lies within the fascial web. So when we have tightness in the body via the fascia from tight space in utero for babies, they come out, tethered oral ties, accidents, injuries, surgeries, dental work, that tight fascia pulls on this system, the cranial sacral system. And so that's going to affect nervous system. It's going to affect the cranial nerves and obviously oral function, as the fascia and all of the tissue in the mouth is fascia. So what we're doing in craniosacral fascial therapy is we're finding the fascial strain or the tightness in the body, and we're gently unwinding it to relieve the tightness in the body and to optimize the function of the brain, the cranial nerves, and the cerebral spinal fluid flow and function. So in CST, cranial sacral therapy, which Kim and I also love and practice and study, cranial sacral therapy is a little bit different in that we find for infants, I guess I can put this down now. We find for infants that if they're very tight when they're born, that the fascial system and the tightness will override what we can do with craniosacral therapy. So we often find that we really need to address the fascial strain and the tightness in the body and the oral ties to optimize the craniosacral system. So that's a very, brief explanation of the difference. We have a little sort of paragraph written up on our website in the FAQs about, more specifics about it. But one of the other things that Kim will explain in just a minute is we have an assessment tool in the Gillespie Approach, CFT, which is we listen to the brain cycle, and that's the expansion contraction of the craniosacral fascial system. And I'm going to let Kim talk about this, but what Dr. Gillespie discovered was that there's a longer tide with our cranial sacral system. And we want to feel this expanding and contracting for the long tide. And we count this. I'll let Kim explain it to you a little bit more. But this is how we assess the tightness in the body and what's going on for that person. So Kim, you want to explain our little brain cycle? And for those of you who can't see, who are just listening, we have a model here of a toy that you can get on Amazon called a Hoberman sphere. And it's a really great, sort of demo of like what we're talking about with the expansion and contraction.
Mm-hmm.
Yeah.
So cool.
Okay, so I'm Kim Sherlock. I am in Westchester, Pennsylvania, outside of Philadelphia. And I also just want to say I get to work with my bestie too. So we've got a set of besties on today.
Yay!
Together since 2015. We have been practicing in our own practices. And when Dr. Gillespie decided to retire from teaching, we took over the teaching. So with him, we've been able to, coordinate and collaborate on the classes that we teach. So, but back to Brain Cycle, because Brain Cycle to me is one of the really incredible tools that we have with CFT. So, there's a motion to the brain, an innate motion of expansion and contraction. And that is what we teach and we feel when we are assessing someone. So if we come on and we land on the brain and on the head, and we can feel this beautiful expansion, nice long expansion, nice long contraction, it's smooth, it's even, it's symmetrical, we know we're in pretty good shape. If we come in and we land and sometimes we don't feel anything, we call that a zero brain cycle, or it's very quick in and out, or it's very skewed and asymmetrical. We know that there's some kind of tightness in this web of fascia within the body that's bearing down and inhibiting the optimal flow of cerebrospinal fluid. So why is that important? Cerebrospinal fluid flows from the brain down the spine out into the fascia. It helps nourish the body. It helps detoxify the body and just puts us in a better healing environment within our bodies. So our goal is always to be improving that cycle, because it tells us that something's happened and that we've opened up the body in a way that will allow for optimal healing or health.
We want to introduce the Spot for Tots course, a parent's guide for toddlers ages 2 to 5 for mini Myo. We have Megan and Kimmy going over nasal hygiene, myofunctional exercises, breathing exercises, tongue-tie healing protocols, and then we have Jenny June going over sleep hygiene, and Kelsey Baker going over feeding therapy and body work. The course is $297, and the link will be in the description.
And so, like I said, we teach that, and it's quite a great moment when we see the light bulbs go off within our students that they can actually feel this motion. Mm-hmm. So that's that's a pretty important piece of our work, because it tells you that something's happened as the practitioner. The correlation between people having a good brain cycle or improving their cycle and feeling relief of whatever symptoms they may be coming with.
So when we had Dr. Shirazi, he was doing a presentation about the TMJ and the cranial bones. He explained to us that the cranial bones kind of expand and contract with our breathing. Is that a part of what you're feeling when you're assessing that that brain movement?
The cycle that we feel is not related to breath. So it's separated out from breath. So, there's all different types of systems within the body. And this system is not affected by breath. We've played with it, had someone hold their breath, and you can still, you can still move right through a steady cycle.
That's amazing. So is it like, I've heard that it's really subtle, but is it softer than a heartbeat?
It's very subtle. It can be softer than a heartbeat, and everybody feels differently. So sometimes you can feel a cycle and it's just like, boom, there it is. And other times it feels like a whisper off into the distance. So it's really, it's practice and feeling. We tell our students when they leave, go home and start practicing cycle, because although they get to work on a lot of people within the class over the 3 days, it's like anything. It's practice to tune your listening through your hands to that type of emotion.
So talk to us a little bit about the fascial system, because we've had like a cranial sacral therapist on, but I'm curious about more of the fascial system. I've heard the fascial system explained as like the connector piece between muscles, wrapped around the muscles to skin. But I've also heard it as described as like the electrical system of the body, like where you would put acupuncture needles in. I've also heard it described as like your emotional organ, that it holds some of your emotions and trauma. What do you guys know about that?
We love to talk about this piece.
That's yes and yes.
Yes. Kim and I were so lucky to be able to do a 6-day fascial dissection training with Dr. Gil Headley in Colorado Springs this summer.
Cool.
And so it's been a dream of mine to be able to do it for probably 10 years. I've been kind of having it on my bucket list checklist. And so we got to do it. And it is, you don't truly appreciate fascia until you see it. And this was an unfixed cadaver, so there was no embalming at all. It was just, it was the real deal. So it is encompassing everything within the body. It wraps around every organ, every endocrine, every body part, around the brain, around the spinal cord. It's all the tendons and ligaments and connective tissue in the body. And it varies in consistency. So for example, right underneath the skin, we have what we call superficial fascia, and it's quite thick. It can be in different areas of the body, this thick. And it's the fascia that holds all the adipose tissue together. So it takes a while to get through that when you're using a scalpel to cut through that. And then if we go a layer below that level of fascia, we see the superficial fascia. And that looks more like like white webby stuff that you would see if you lifted up a piece of chicken skin, and you would see that like kind of film that lays on top. And that's a whole layer of fascia on top. And then we can go a layer deeper than that, and we see the really dense, thick connective tissue, what we call deep fascia. And that's wrapping around the muscles. So there's layers and layers and layers, and it's really endless. We were there for 6 days, 6 people dissecting, and we could have gone for another 6 days. It's just, it holds everything together. So if we were to take your skeletal system out of the picture, and on his website, you can see some of these dissections where it's just the superficial fascia removed, we could still see, oh, there's Kemi or there's Megan. It's like we can see the outline. So it holds everything together. So you can imagine that any input into the fascial system, which we call a web, is going to impact us structurally, the function of our organs, endocrines, and body parts. And also it's a really big system. So when we have trauma or emotional memories, things get stored in that fascia because it's so easy for the innate wisdom of the body to put it there and keep it there. So when we haven't processed something emotionally, we often see that comes out when we have someone on the table or in a training where they're having an emotional release because the fascia is releasing, and they don't even know what it's about. They're quite surprised, like, wow, I didn't see that one coming. I wasn't thinking about anything in particular. I wasn't upset. And then they have this big emotional release, and it's sort of like peeling the layers of the onion. That's kind of how CFT works, is we have this accumulated fascial strain in our bodies from fetal life forward. And so depending on how roomy it was for us and what happened to us in utero, and then what happens after we're born, as far as our ability to be able to move, to be able to have optimal oral function. So that's a big piece of what we're looking at and I know this relates back to the work that you guys do. Kim and I work on babies every day, and we're just so passionate about working with the babies because that's where we can make the biggest difference for their trajectory of how they're going to develop their airway, their palate, their eating habits, their everything. So if we can get those babies from literally day one we're impacting and affecting optimal function, and really a ton of education, because people don't know. As you know, this is still, while it's, really cutting edge and we all know about it, it's kind of a niche thing still that people don't understand the connection of the fascia and the cranial sacral system to the development of the optimal function of oral function and cranial nerves.
I just want to go on and mention that Dr. Gillespie developed this work in the 70s, and he was a periodontist. So,
so crazy.
So, he kind of combined the osteopathic principles of the cranial work with myofascial release work, John Barnes type of work, with the oral structure work as the dentist in him. So realizing that the oral structures, the tongue, everything in the mouth, the teeth, there's fascia that has to be addressed, and the TMJ and all of these structures. So if you're not addressing that, we're missing a very big piece of the puzzle. So, that's what kind of sets CFT apart, are these three components. And what we found, and Holly and I learned so much over the last, I'd say 6 or 7 years, from people like you who are in the dental community, who have that open, integrative, holistic approach to health, is that the oral structure, the tongue, is just like the beginning of everything.
Oh, yeah. Literally, like just.
What was interesting when we did this dissection was we were able to look at this gentleman's tongue and frenulum and move things around and literally see how it was pulling into other areas of his body through this fascial network. I mean, it was like just a wild experience, and something I'll never forget, to be able to really, we talk about it, but to see it.
So what did you see? Like, if you pulled on his tongue, what did you see move in other places? Do you remember?
You could see movement down through the trunk. I mean, you could see movement. And it was, we will never be able to do a tongue release in real life.
I know.
But we're able to, Holly got the scalpel and she performed the tongue release.
So fun.
I love that.
As
That
best
sounds
I could,
amazing.
a functional frenuloplasty.
Yeah. So anyway, that was a really great experience for us. So when we're working with infants, all the way through the elderly, we are always looking in the mouth at the oral structures, and we can do a lot of fantastic work. We certainly can't release any ties that are there,
Right.
but our goal is to clean up any tightness in the mouth, right? Particularly under the tongue, that floor of the mouth, so that if the person or the infant is going for a release, it's cleaned up. And when you go in and you lift that tongue, you can see that frenulum so clearly and get a beautiful release, because that whole floor of the mouth isn't coming up with it. And so many times we have these babies that come in and they'll say, my pediatrician said there's no tongue tie. This one said there's no tongue tie, that one. And it's just like, okay, we're able to go in, clear up that tightness, and then the frenulum almost pops and you can clearly see that maybe we can do this again. So we like to do our work. And like I said, there's so much underneath that tie, get all that tightness worked out up into the point where then we turn over to a provider and to myofunctional therapists. And if there needs to be any kind of expansion done, if it's an older child or person, and, it's certainly a team approach, but to get that person ready, and then, maybe during treatment as well, working with myofunctional therapists, and after, it's just a beautiful outcome, because it's not just this little frenulum, as you know,
Right.
and it's not just the tight TMJ, as you know, it's all related. So that's why we believe the bodywork piece is a very important piece of what you're doing as myofunctional therapists and the dentists who are doing the releases. So
I have a question for you. So with our patients that have the tongue tie, or they have like some sort of oral dysfunction, we notice a lot of tension in the back of the neck, like in the occiput area, or in the SCM or the stylohyoid, the tendon right underneath the earlobe. what is the fascial connection with the tongue dysfunction, and why does it pull on those muscles?
Well, we don't, it's interesting because we don't really, we don't have a technique that where we say anybody who has TMJ, this is what you do, because we are really looking at, the fascia is a web, and we might feel tightness in those areas, and it might not be unwinding from there. So unwinding is kind of a general term that we use for releasing of the fascial strain within the body. So we'll say, wow, the fascia is really talking to me here. It's very tight here. I can feel, I'm feeling somebody's TMJ and the right side is really tight, but I'm not really getting any release from there. When I go there, it's not talking to me as far as unwinding. So then we move around the body and we find where the body wants to release the fascial strain from. And then we come back and check that. So yes, Kimmy, to what you're saying, we feel all that too. We can palpate the occiput, that, all of this area. And but we still just, we kind of talk about the innate wisdom of the body, and that the body knows how to heal itself. It's always self-regulating. It's always trying to create homeostasis. And so each person is different and everybody's story is different. So we have to honor that, when we have that person on the table, is we're saying, okay, body, we're making this observation for you. Where do you want to unwind from? And sometimes it might be all the way down at the big toe or the knee, and the person gets relief from that unwind, all the way up into, the TMJ.
So interesting.
Well, I know in acupuncture, one of my best friend's mom's an acupuncturist, and gosh, this was several years ago. I had the worst, kind of tight tension up in my right trap, and she went to go down and work on my left leg, kind of on the inside. And I didn't really think much about it at the time, but then she started really working on that. And I'm like, wait a second, are you serious? This is really working. And, open that up. And that was kind of my first, I wasn't even into myo yet. I was probably 22. But it just blew my mind and that's kind of what even just sparked me to be like, the whole body is connected. This does seem, and then as I, went down my own rabbit holes, obviously I understand that now. And that's if I sleep funny and have that, that's my go-to, is I go massage my inner calf. And it's just one of those things where I'm like, oh, every time it works every time.
Yeah. Well, think about this too. The meridian system is an energetic system in Chinese medicine that lies within the fascial web. So if you have any tightness or pulling in the fascia, you're going to be affecting that energetic system as well as all the organs, because all the organs are directly, related to each meridian.
You're speaking my language right now. I'm like, I got goosebumps.
Yeah. And it's, it's we always think of structure and function going together. So when you have a tight structure, the function of all of those organs and endocrines are going to be affected. And of course, we're talking about the brain, because we have 3 really dense layers of fascia around the spinal cord and the brain. And so when that's tight, when that fascial system is, inhibited, then of course we're going to see all the things that go along with nervous system dysregulation that we see in babies and kids and, adults. It's so common and a really big piece of the puzzle for us when we're, we ask those questions when we're doing our intake about, nervous system regulation and some of the things that, the cranial nerves affect that I think maybe some of the professionals out there, if we always say, people will say, well, will CFT help for this or help for that? And we always say, if it's a fascial component that's inhibiting or, affecting that, that symptom, then yes, it's going to be that piece that helps, and it's never one thing. It's always, many things, that we're looking at put together, many modalities. So CFT is just.
Yeah. And I think that's important too, to talk about. There's, so many modalities and things that come in together. We all work together as a team because we all work on different parts of the body, and there's so many different ways to approach it.
And the myofunctional piece is so important that we really feel strongly about. We can't leave that out at all. Kim and I studied myofunctional therapy, I think with one of the very first Breathe Institute trainings, and we love it. We love it. And so I don't have time to do full-time myofunctional therapy, but we have our people that we refer out to that are near us. And it's just, you got to do that. It's just part of the whole package of, creating optimal function.
Yeah, because if you release it, but if they do that weird pattern over and over, they're just going to pull it back in.
Yep. So we get a lot of questions too. We see a lot of people kind of respond and ask questions about, it's called Ehlers-Danlos, where it's like the hypermobility. How does that kind of play in? Do you guys work a lot with those type of patients who have those syndromes?
We actually have, and it's funny because it's a connective tissue disorder where they are very flexible, and so we have to be careful, when we're working with them at the joints and everything like that. However, there is an underlying tightness to them. And the few people that I've seen with Ehlers-Danlos have done very well with their level of pain. And so there's some kind of tightness that I think may lie so deep that the CFT has helped them with. But again, you're certainly going to want to be careful with someone that has some type of a connective tissue disorder like that.
Yeah.
What is that disorder? Because I think a lot of patients that are tongue-tied also have some level of this. And sometimes they're very symptomatic, and sometimes they're so hyperflexible that they're not so symptomatic. They could have horrific forward head posture. And I'm like, does your neck hurt? And they're like, no.
What? Are you sure?
Yeah, I mean, I think the genetic piece is, just for every person, just because you have a mutation doesn't mean that you're going to be expressing that, the symptoms of that. So it probably is a lot of epigenetic factors, meaning their environment, the food that they're eating, the self-care that they have. So someone can have, a terrible genetic lineup and be doing great because they're really taking care of themselves. So I think it goes sort of like this with MTHFR and some of those midline things. We see a lot when I have the Ehlers-Danlos people on my table. They say, oh yes, I have a tongue tie, or I also have, I know that I'm, I have mutations on MTHFR. So we see that a lot. And it's just that genetic piece. And then we just, epigenetic factors are a big piece of how people express, symptoms.
I had a girl and she had some hyperflexibility, but she said when she'd go to the chiropractor, she didn't have much of a response to it because they would try to pop her, but she would just kind of go with it. And so I suggested to her that she find someone who could work with her fascia, because I thought maybe that would be more effective for her since the traditional popping didn't so much work. Do you find that is those people that have that more hyperflexibility are better with cranial fascial therapy or cranial sacral?
I don't know that. I don't know as far as how they do with chiropractic, but they do well with the craniofacial work that we do. The other thing is, just for anybody who sees a chiropractor, the craniosacral work works great because we're releasing the fascia, and then they go to their chiropractor and they're able to get a better release, and the release is able to hold.
Right.
Because if the fascia is still tight and pulling you back out of alignment, you've got to keep going to get it put back in. So chiropractors will remark on how well their patients are doing after seeing us. And we get a lot of referrals from chiropractors, and a lot of chiropractors have taken our work or taken our class so that they can incorporate the work and get better results for their patients.
Yeah. Yeah. And that makes total sense. So what about patients who have gone through some sort of traumatic brain injury or stroke? Does that kind of change their, that brain wave,
Probably at a zero cycle when they come in. They've got lots of symptoms. And when we open up that system, remarkable things can happen. I mean, the healing can just the amplitude of healing just goes up. And whatever other therapy they're doing, OT, PT, vestibular therapy, they're able to do at a better, with better outcome, because now their body is open and, the healing is more available. So I work with a lot of brain injured concussions, stroke patients, and it's really remarkable to see. And I wish that it was a part of every concussion protocol, But we're slowly trying to get it out there that it's a very important piece of brain injury.
Yeah. Well, and if you've been a longtime listener to the podcast, you guys know that my dad had a traumatic brain injury 5 years ago. And we went through functional neurology, and we've done a handful of different things for him, but I had never thought about the cranial fascial therapy. So, he might be coming on the road trip to Seattle with me, and he can be your he can be your example.
And maybe we're going to take someone in your area, and you'll have someone.
Yes, that would be awesome too.
Our goal, right, is to have some therapists available for people who are seeking this kind of help.
Yeah, my dad loves being a guinea pig. He was my first myo patient. We got him to stop snoring, so loves being a guinea pig.
So, Holly, since you have at your office some of your tools and your props and stuff, can you kind of explain to us what cranial fascial therapy would look like or feel like as a patient versus, like, I've had cranial sacral and I was low key like, I don't feel anything. Can you kind of explain like what it would feel like, or show us on like a little model like what the touch would look like?
Yeah, I need a little mini like doll here, but I can really explain it probably better and probably give you a little bit of a visual. I don't have a person in here, but
Kimmy, jump through the screen.
So it's a very gentle modality. So like we said, we use it on infants that are just born all the way to, I have clients that are 90 years old. It looks different for every person because obviously every person is different. And some people are very kinetic and move around a lot, and some people are very still. So the movement on the table is never indicative of the release. And I think sometimes people think that the more movement they see or that they experience, the more unwinding they have. So but to explain this system a little bit, so we always have a hand somewhere within this system, which is the cranial sacral system. And we have a hand on the occiput if we're working sort of, trunk up. And then we have a hand on the sacrum here if we're working, abdomen down. And we're in what we're always asking is, with my hand in this cranial sacral system, and then I take my other hand and I'm out in what we call fascial land. So I might be palpating a knee or a pelvis or something. And when I say that, I'm just landing there and I'm asking myself, is there any fascial strain between my two hands? And if I get a yes, then I wait there. And then I wait for the innate wisdom in the body to see if it wants to unwind from there. So that unwind might look like, oh, I feel it in my sacral hand. The sacrum is starting to twist and turn a little bit. Or it might be, oh, wow, I really feel that in the knee. My fascial hand is really active right now. Or it might feel like, wow, they're really connected and this hand is pulling into this hand. And to me, it feels very obvious and strong, but the person on the table might feel nothing. They might say, I don't feel anything. Or they might say, wow, I really feel that, it really feels like it's vibrating, or it's, I can feel what you're talking about. And then, the person might move around on the table a little bit, sort of like when you wake up in the morning and you might have a little bit of a morning stretch like that. It might be that kind of a movement. Generally, that's what we find is that, we have to kind of explain to people what to expect, because you're laying there and you have no idea. And like you said, Kimmy, cranial sacral therapy, you're like, now that if you've studied it, it would be different. But I remember laying there too and just thinking, wow, it feels really great, but I have no idea what's happening. 40 years ago when I had my first, treatment, I was like this, and then even when I took cranial sacral therapy, CST, 25 years ago, I was like, this is so boring. It's just like, I don't think I can do this. I could sit for an hour and do this. And then, as the years went on and I retook it again and started using it, I realized that there was more to it than I experienced, the first time receiving it. But that's what it's like. We're really asking, fascia hand, cranial sacral hand, what's happening between the two of them. And we're following that unwind, which is different for every single person. It looks different. Yep.
And it's not so much like you're doing trigger points like myofascial release where you push and hold, or you have them push and then you have them move. So it's different than myofascial release. It's very gentle. It sounds almost like almost like you're holding the sacrum or the occiput, and then you're almost doing like a sort of Reiki style where you're just kind of like placing or resting. Is that
It's
kind
a
of like the
very
touch similar?
Yes, in a way, but it's a very we're teaching you how to feel fascia. And
Right.
so yes, that is a subtle feeling. And Dr. Gillespie, when he started working with the infants, he would call it infant-driven movement. So there is a very palpable feel to tight fascia and a very palpable feel to that unwinding. And that's the nuance of the technique and the modality, is teaching people how to feel that. So when you say Reiki, we're not putting any kind of energetic, sort of thing into the body. We're really asking, between these two systems, what's happening.
Interesting. So in a way, you're almost like an intuitive healer, but also like you're like talking to the body and the nervous system. Is that more accurate?
The body's talking to us.
Yeah.
So we're the co-pilot. We're just making an observation of exactly what the body wants to get to that next level of unwinding and optimal function. So we're always making observations and really trying to not have an agenda. We're just really trying to listen to the body that's on the table in front of us.
So beautiful.
We're following the body. And that's the big piece that we need to be able to teach our students, is that we are not forcing, we are not manipulating, we do not have an agenda of where we think an arm needs to go for the shoulder to feel better or something. We're feeling into the body, we're feeling the tightness, and we're listening to their body and how do they want to move in that moment in their own time and space to release that strain. And that's why we're able to do this on infants, because you can't hurt anyone if you're genuinely following where their body wants to go to return to that place of health and homeostasis.
I love that.
So beautiful. You guys
Yeah.
are so wise.
Oh God, you know what? We're very fortunate to have, to come on this path and to be able to help so many people and to teach so many people to help so many people. It's a good life. It's changed our lives, and we're no wiser than anyone else.
And so grateful to Dr. Gillespie, to Barry, for being the pioneer of this some 30 years ago. So imagine 30 years ago, there was no tongue ties and the Munch Bunch and podcasts. I mean, he was really a pioneer. And kind of really a renegade, going out and saying, no, I feel my clients are showing up with all this strain. Why isn't anybody addressing their allergies, their asthma, their anxiety, their depression? He was seeing all that, and people were saying, well, that doesn't have anything to do with, what you're doing. So he really was a pioneer in that way of creating this, system.
Yeah.
Where there was nobody else, no support doing that.
Yeah, very much so. Like, I think Dr. Kotlow was doing releases since the 70s or the 80s, but yeah, they were like the OGs.
Like, that's it, those two.
There was no internet, so how would you know about any of this unless you just read it in some sort of medical journal, right?
Yeah, that's one of the big things I tell patients these days. I'm like, the power of social media, love it or hate it, like being able to connect with people and connect these ideas, can really help move all of our fields forward, versus, when there wasn't the internet and you could, only kind of tell your local people, right? Like, where we now can see patients all over the world, and help people everywhere, which is really cool.
All right, ladies, last question, then we're going to wrap. What is the connection between the fascial system and the lymphatic system?
Well, the lymphatic system lies within the fascial web. I mean,
does it really?
Of course, that's, all of that is all connected. That, like Holly said, the layers and layers and layers. So if there's tight fascia squeezing, and we release the tight fascia, anything can work more optimally. It goes through for lymph, cardiovascular, digestive, vagus nerve, tongue. I mean, it's everything. So that's always what we're looking for, is where's the tightness? How can we free it? And then what does the body want to do with that? So, someone may come in and say, I have migraines. Can you help me with the migraines? And our answer is, we don't know. we're going to release the system, we're going to open things up, and then they're going to see how their body responds to it. And like I said in the beginning of the podcast, typically, the better we get the brain cycle, the more benefit people are able to feel with a relief in a lot of their symptoms and issues.
Yeah.
So beautiful.
Cool. Okay. And technically that was the last question, but I do have one more.
Okay.
If people want to find a practitioner who is doing the Gillespie approach, how can they do that?
So right now, the best way to do that is to go onto Facebook, and there is a page called the Gillespie Approach Therapist Request page. And they can say, hey, I'm in Seattle, Washington, and someone can chime in if they're in that area. One of our goals this year is to develop a practitioner list of the people who Holly and I have trained. So we're going to be working on that. But right now, Facebook is the best place to go and to connect with somebody.
Perfect.
Yeah, and our website is craniosacralfascialtherapy.com if you want to learn more about CFT, about the classes we're teaching throughout this year ahead. You can go there. And then Dr. Gillespie's website is GillespieApproach.com. And he's got tons of articles and tons of information to learn.
And if you guys want to fly to Westchester, Pennsylvania, you can see Kim in person. If you want to fly to Chapel Hill, North Carolina, you can see Holly in person. If flights are, obviously cheaper on the holidays, but you can also go see them.
Training, learn it yourself.
There you go.
On your family and friends.
There you go.
Do intensives. They'll come in and they'll stay overnight and get a few sessions in. Dr. Gillespie is not far from me in King of Prussia, Pennsylvania, but there's lots of practitioners out there. We've been training since, for 2016 now. So hopefully you can find someone close to your area.
Yeah.
And who can take the training? Do you have to be a massage therapist?
Yeah, anyone. So we teach everyone. Yes, we've got highly educated doctors, chiropractors, orthodontists, people like yourself, myofunctional therapists, massage therapists, OT, PT, nurses, all the way to, I call them the moms, the moms who come that want to help their families. Maybe there's a special needs child in the family. They want to be able to do consistent work. And we can teach them these techniques because it's so gentle. It's so right brain. You don't need to have all of the background and all of the techie biology, physiology, anatomy, So the answer to that is anyone.
That's amazing.
Love that.
And it's so great to be in a room of, 40 people with so many different backgrounds because we learn from each other as well in those environments. And over the 3 days, we have a foundation training, which will teach you the techniques to work on children through adults, toddler through adults. And then once you've taken that class, if you want to work with infants, we have an infant class, which is 3 days, and we bring in somewhere from 30 plus babies, pre-crawling infants over the 3 days that get to work with the students in groups with Holly and I along at their side. And the babies come in over the 3 days and we're able to see the changes. So the students get to see the parents come in, they're feeding better, they're sleeping better, they're pooping better, they're just happier, their nervous systems are calm. So that's a pretty remarkable class because you're really hands-on with the babies and there's no better way to learn body work than hands-on.
Oh man, that'd be sweet.
Yeah, very, very hands-on. And you also, when you take the foundation, you get 3 days of CFT because we're just constantly trading with each other and practicing the technique. So lots of great things happen on personal levels for health.
So cool. Yeah, that's even better. Oh, I love it. Well, thank you guys so much for joining us today. As you guys know, you can catch Kimmy and I on Instagram and social media at the Munch Bunch Myo podcast. You can catch Kimmy at Mouth Muscle Memory and myself at NWMFT.
A Facebook page called CFT Global Team. Is that what it's called, Kim?
Yes.
And then we do have an Instagram. I think it's called CFT Gillespie Approach on Instagram. Yeah.
Thank you, everybody, for listening to the Munch Bunch Myo, and we will catch you guys next time.
All right. Thank you.